Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us.
It's Dr. James Rossi, who is my colleague at Family Practice Associates. Welcome.
Hi. Thank you for having me.
Well, now, I mentioned, we've talked a lot about the COVID vaccine, and we've been really pressing people to get the COVID vaccine. You may want to talk a little bit about that, but what about the flu vaccine? It's important also.
Absolutely. I think people are much more accepting of the flu vaccine because they know it, and they've heard about it, they've seen it for years. And the flu vaccine is something that we actually update yearly through the CDC so that people can get that. And we have not seen nearly as much flu for reasons that I won't guess on. But even without seeing that flu, I think the flu vaccine is very helpful to protect you from multiple infections at the same time. You don't want to have two infections at the same time. So.
Now, you mentioned flu vaccine. Are there different types of flu vaccines?
There are different types of flu vaccines, and I expect most people's experience is knowing that they need a flu vaccine. And anybody 6 months and up likely is going to fall into a category of flu vaccine that they need. And you can trust that your doctor knows which type of flu vaccine you need. That may change based on allergies, or that may change based on age.
Now, do you think you saw less flu because we've got masks on and we're trying to do things?
I do think that. Yeah, and I don't know, I have not looked at the data on that, but that seems like a very likely source of containment, that we're not seeing each other as much and we're covering ourselves from spread.
Now, you mentioned flu vaccine, masking to prevention, but what happens if you get the flu? How do you know that if you have the flu versus COVID? Is there a way to tell?
I would say that the testing is the most accurate way to tell. If you're questioning your symptoms at home, you probably should be asking your doctor what that might be or finding a testing facility. That said, the flu tends to be a little more whole body, affecting muscles and joints, causing higher fevers faster, usually fatiguing people. And we do have treatment for the flu. We're working on treatment for COVID the same way we treat the flu, but if you can catch the flu early enough, then you can do something as simple as a pill to treat the flu, which we have at all our clinics. Yeah.
Now, you mentioned the test. There is a specific test for flu and a specific test for COVID.
Yes. The tests are done in a similar fashion. The flu test is looking for different strains of flu A and flu B, which are the two lineages that are most common. And COVID right now is looking for a very specific portion of the virus that can be found in people that have COVID positivity.
Now, you mentioned similar symptoms. Smell and taste, I think, is a little different with COVID, but is there anything else, or you just kind of have to base it on the test?
I think the most specific for COVID is smell and taste. You also note that COVID has a higher chance of fever than something like the common cold, but so does flu. It is difficult to know, especially with the change in variants. The symptoms of COVID have changed. And so we're seeing a few that are more mild and upper respiratory. We do see with COVID some GI symptoms. And I have a lot of patients that they'll note that they've had changes in their bowel habits.
Now, you mentioned the pill for the flu. So tell us a little bit about pills for the flu, and maybe down the road a pill for COVID?
Yeah. For the flu, if we can catch you in the first 48, possibly the first 72 hours of you being sick, then we can give you either a single dose pill, Zofluza, or we can give you Tamiflu, which I think a lot of people know Tamiflu. That pill works to stop the virus from doing what it does in your body until it just dies out, which means that usually you feel better faster. Not right away, but faster. And with COVID, hopefully we'll see soon that we have medicines that can be taken not as an injection, not as an IV, but as a pill. And I think it would apply the same way. We would try to use the pill as a way to keep you from going to the hospital, to keep you from getting so sick. And the earlier we would give it, I would assume the better. There are multiple companies working on pills for that.
Now, you mentioned keep you from getting sick, going to the hospital. The flu can really make you sick, especially if you have some other illnesses and lead to other things down the line.
We definitely see the flu affecting more people that are elderly. That's why we have a higher dose flu vaccine for them, and obviously why we push it very hard. It can be deadly, but it definitely is much less deadly than something like COVID. So preventing them both just makes the most sense.
Now, so what are some of the things like flu? You can have heart. We had a cardiologist, so the flu can maybe affect the heart, but especially in older people, can give them pneumonia.
I think so, and hopefully you understand that pneumonia is more of an explanation of how the lungs are reacting to something. You can have pneumonias from bacteria and from viruses, and the flu is one of those. Unfortunately, if you have shortness of breath, I still cannot tell you if that is just COVID, because flu can cause pneumonia, even though that is more predominant with COVID.
And just real briefly, we've talked about a little about COVID, flu vaccine, but there's also a pneumonia vaccine.
There is. And to add a little confusion, there are multiple pneumonia vaccines, but in time, everybody needs all of those. We try to get those now when you're very young, and also when you get a little bit older, or if you have certain conditions that make you need that vaccine earlier. Most people, they're going to be looking at doing a pneumonia vaccine when they're around 65 years of age, and then keeping up with that. I know the recommendations there are changing, so sometimes we talk about boosting that immunity later in life, other times we just leave it as it is.
Okay. That's great information. We appreciate you coming in. So if you have a fever, think you might be sick. It could be COVID, it might be the flu, but make sure you get your vaccines for both. We'll be right back.